What type of teaching approach or philosophy have you adopted as an adult health care educator?
So when I took my course, and it was adult education, we learned Knowles principles. I don't know if you're familiar with Knowles. He did a lot of work in adult education. It really opened my eyes to a lot of things, how adult learners are very different, and that you can never, you have to respect the knowledge that they bring. As everybody as an adult actually has some background that they're bringing, and you can learn from them. I think the 4 principles that I really think are important are the planning and evaluation. So they have to be responsible for planning and evaluation. The experience itself, so they learn from actually hands-on,
right.
Which like I said, I think that was huge focus of my learning, because I did a lot of different
right.
clinical areas. The relevance, so it has to be relevant to their practice.
Yes.
And then, of course, lastly, it's problem-centered. So if we do simulation, it's usually a problem-centered,
right.
and then they can figure out between them. I think that one of the most important things, though, is to utilize the skill of debriefing, and always, whenever we do simulation, or even if I'm just talking to staff, utilize the skill of debriefing, and be curious, ask questions, and then make sure that you're getting them to the same place where you want them to go. So if you have an objective that they're kind of being curious and asking the questions, so it's more or less almost like guiding them to get to the right answer. So you're not giving them the answer, but they're getting that information, figuring it out themselves. Because if you figure it out yourself, it always sticks with you.
Definitely. What are some of the largest barriers that students face, and how do you attempt to mitigate these as a healthcare educator?
I believe that probably the biggest thing that we see is insecurity in the workplace. So once you have that insecurity and you're in an environment that is unpredictable, a lot of things can occur. So if you have insecurities or fear to ask for help, a lot of things can deteriorate. If you don't recognize the patient is deteriorating and ask for help because you're scared, that's when really bad things happen. So our biggest concern is that staff feel that they have the ability to ask for help. And that's why I think we have such a strong education clinical focus at UGH, so that people can call us, and Jamie's out in the unit, and I'm developing strategies to improve our education, because if you can't understand that you work as a team, you will never make it in the emergency department, as nobody can go into that emergency department and independently take care of those patients, because it's such a high stress, high volume place to work. So we really focus on developing strategies to build team. Some other things are lack of resources to do the work.
Right.
There's a frustration to me. I find that our computer system is lacking, that we don't have enough computers for staff to actually be able to get onto them during their breaks, or even during a shift, because there's so many people competing. Because it is a teaching hospital, we have residents, physicians, all competing to get computers. So that can be a challenge. Money is definitely a challenge, and providing courses. We currently just started an initiative where the staff pay $50 to get a class, which is advanced cardiac life support, and I teach that, and they put that $50 in, and that money is used to provide books,
right,
equipment, but we're actually putting it in ourselves. So money is definitely a frustration, because of course, when you look at healthcare budget, it's very limited. So
right.
In order to get the education done, I think we have to come up with different ways of figuring out how to raise money ourselves.
Right. Where do you foresee adult healthcare education progressing forward?
In simulation. I really believe that simulation is the way to go. It provides an environment that is safe for the learner. When they come in, we tell them that everything that happens within that simulation is safe with us. We do not discuss it with anybody else. So they're comfortable in asking questions. The use of high fidelity mannequins really allows the student to do hands-on interventions, starting IVs, intubating the patient without harming anybody, but being allowed to learn. And it also is great for team building. The one huge area that has to go along with simulation is the debriefing session. And in that debriefing session, you have your objectives and you discuss how it went. You inquire and you try to get that learner to the point where you want them to understand where they went wrong to validate their learning. Because that's how adult learners learn the best. If they make a mistake, they identify the mistake themselves, and then what do they take away from that situation is how they will go forward doing a better job.
What are the current strengths and weaknesses of adult healthcare education?
Well, there's lots of things that have changed in the last 30 years of me being in nursing. Online. So we can put tons of things online, so if you don't have time, you can certainly do it at home. The use of simulation, which is huge, and having the ability to do that with somebody who's trained in debriefing in order to obtain your goals and objectives. Having educators on the unit. Many years ago, there was never an educator, so having somebody that's just focused on assessing people's learning needs and putting something in place in order for them to achieve those needs is extremely important. At BGH, we're very lucky that they restructured the department and added 2 people to manage the education.
Dr. Harrison, you're a professor of public administration at the University of Albany in New York. Can you tell us about the courses you teach and why you decided to transform one of them into a massive open online course, also known as a MOOC?
I teach courses to managers of not-for-profit organizations, and one of the courses I teach is on a specialized area called the governance of nonprofit organizations. And the governance of nonprofit organizations has been a significant problem with boards of directors being volunteers and not really having access to the knowledge and skills needed to govern those organizations effectively. So the course I teach on site is an elective course that I offer to maybe 10 or 15 people a year when there was a global demand for this course around the world. And so we decided to transform the on-site course into a massive open online course and had over 16,000 people from 188 countries register in its first offering. It's since been transformed into 4 smaller massive open online courses into a specialization called the Leadership and Governance of Nonprofit Organizations, and it's reached over 40,000 people just in the last year.
Dr. Harrison, what do you think are your MOOC's strengths? Also, what do you think are your MOOC's weaknesses?
Well, I think the biggest strength of the MOOC is to take a course to scale, so to offer it in places where people can't come to universities like the University of Albany and take a course like this, who need the knowledge in the field. So for those people, this is important. I think that's the biggest strength is access. I think one of the weaknesses of MOOCs is that not everyone who starts the MOOC will complete the MOOC. So we're not really sure the level of academic achievement of those students and the actual learning outcomes that they've met. We do know that for the students who complete all the learning activities in our MOOC, that their academic performance is no different than the students who take the on-site class. So I think completion rates are a weakness, and more work needs to be done to help learners complete.
Dr. Harrison, how do you think MOOCs will impact the landscape of adult education in the future?
Well, I think they'll impact it in a couple of ways. One, for people who don't have access to universities or the benefit of higher education will have access now to some of the best courses from the leading institutions around the world. So I think increasing access to higher education for a population that would never be able to access it, that's one. I think there's a whole new world emerging in MOOCs around professional development and vocational training, and breaking up these big courses into smaller, short courses on specialized topics that people need managers in the workplace. I'll give you an example, like project management or leading a team. Those kind of courses are going to grow, and we're seeing the industry teaming up with these large providers like Coursera and edX, and teaming up to provide a range of professional development opportunities to the workforce, so training the next workforce.
Dr. Harrison, do you think that MOOCs have a place in healthcare education, and why?
I think they have a place in healthcare education for many of the same reasons I cited for not-for-profit organizations. You have nurses in remote areas unable to access traditional learning, so distance education, which has been around for a long time in healthcare. I'm a former nurse, and I did my Bachelor of Science degree, finished up many of my community courses by distance, living in a remote region. It's one of the reasons why I believe that there's a lot of benefits for these open online courses, and they stem just from the benefits of continuing education and distance education. It's just that the technology has changed now. We have the internet. There's very few communities that are without access. And so those with it can have benefits to specialized knowledge and training that's needed in healthcare out in the field.
Dr. Harrison, what might account for a low adoption rate of MOOCs in the healthcare sector?
Well, if you're looking at adoption of MOOCs by faculty, so the number of faculty who prepare and transform their courses into the open online environment, there's several factors, such as how the perceived quality of the learning experience. Do faculty really believe that they can offer a high quality learning experience through a massively open online course? So that's one factor. Other factors are that most faculty have never really been educated through distance or online education, so they really don't have any direct experience with it, and they certainly don't have any experience with others who have developed these. So I think as the number of MOOCs grow, I think attitudes towards them, and as the research come up, are going to shift, and over time we'll see more and more faculty adopt it. But I think number one, lack of experience, kind of negative attitudes towards MOOCs as an optimal learning environment accounts for it. On the learner side, what we see is that MOOCs are being adopted by motivated, highly motivated, intrinsically motivated students who see a particular course helping them meet particular needs in a number of areas. So they're adopting these and benefiting from them. But what about the student who isn't motivated? Though again, going back to experience, is this a new way of learning that few students have experience with? And what are their attitudes? Do they really believe that this is money well spent for them to learn online versus going in a face-to-face class? So what are the perceived benefits for them? So I think adoption on both sides by faculty and by students will vary according to certain factors.